Hello, everybody. Today, let's talk to Dr. Anil Kamath. He is a senior surgical oncologist at Apollo Hospital, as well as he is a consultant, see the OPD at Therrapie, Hematology and Oncology Care. Welcome, doctor. Let me ask a couple of questions about the tumorous cancer today. Doctor, what is tumor?
So when we use the term tumor, it's a more generic term. Tumor is any swelling anywhere in the body is often referred as tumor. Tumors can be either benign tumors, which are quite harmless, like a lipoma. They can be of an intermediate grade. Certain tumors tend to have some features of benign and malignant, and there is a third classification of tumors which are purely malignant.
All tumors is cancer tumors?
Definitely not. Most tumors, as I said, are benign. In fact, if we find a lump in the body, the highest chance is that it is benign. But we need to identify few tumors which have the potential to cause harm and are cancerous.
Doctor, is there any other treatment required after cancer tumor surgery?
Yeah, when a benign tumor, usually either we just observe or surgery is the only treatment. Like some people come to us with a fat swelling or a lipoma. Here surgery is the only treatment. But when it comes to a cancerous tumor, here there may be a requirement of multimodality treatment. Usually it's a combination of surgery, chemotherapy and radiation.
Is cancer tumors are really curable?
We can't give a blanket answer to that. It will depend on the type of cancer and the stage of cancer. We have made lot of evolution in the treatment of cancer. Most of the tumors in early stage are eminently curable, but the tumors which are in more advanced stage, which are of more aggressive nature, may not be curable. So we will have to individualize an answer to this.
Is cancer tumors grow and spread to other organs?
Yes, when we use the term cancer, it means it has the potential to grow and spread. So tumors which have the potential to grow and spread are usually referred to as cancer.
Is cancer tumors are genetic?
Now, a small fraction of tumors tend to be genetic. Let us take the example of breast cancer. If we take 100 breast cancer, it may be about 5 to 7 cases that we get a strong family history where many members of the family have had cancer. The rest will be sporadic, or it is just by chance, or we don't know a specific reason. When it comes to other cancers, the incidence is even lesser. So only a small fraction of cancers are genetic.
Doctor, which are the most common cancer tumors?
Now that will vary depending from country to country, the socio-economic strata of this thing, and even the geographical location of the patient and the individual risk factors. Now, if we take all over the world, the most common cancer in females is breast cancer. When it comes to males, usually it will be either prostate cancer or lung cancer. In India, there was a high incidence of other cancers like cervical cancer in females. But by and large now it is breast cancer, at least in cities, in females. And when it comes to males, it's usually lung cancer. But certain regions like in North India, there is a excessive incidence of oral cancer because of the pawn chewing habit. So these are the common cancers in the globe and in India.
Who get this cancer tumors and why?
Now, we cannot predict who will get cancer. There are broadly two factors. One is inherent factors or genetic factors, and other is acquired factors. So inherent, like we discussed, there can be a genetic risk. If there are many members in the family, they can get cancers. When we talk of acquired this includes habits such as smoking and tobacco chewing, or environmental like exposure to sunlight or certain industrial carcinogens, or it can be also due to infection by certain viruses. So these are the various causes of cancer.
Doctor, what are the side effects of surgery of cancer tumors?
Again, this answer will have to be individualized. The side effects of surgery, there is no surgery with zero complications. There is always bound to be some problems which can be on the lesser side or more side. So it will vary on the type of surgery and the location of the surgery. Usually surgery for something like a breast cancer is considered very low risk, whereas those for pancreatic cancer may be very high risk.